Good morning. Welcome, everybody. This is a great-looking crew in the room, and this is an exciting morning. I appreciate all you being here. I appreciate everybody masked up in this room as we're in this tight room together. Small thing we can do, and I appreciate you taking that step this morning. This is an exciting announcement this morning. And I'm going to give a little background to this work, and then I'm going to turn it over to Walter Panzer with the Helmsley Charitable Trust to talk more about the announcement today. But we're standing here in this building, which used to, many years ago, house Falls Community Health, our community health clinic. Most recently, it housed the City of Sioux Falls IT department. We had our communications team in here. We had our GIS team in here. Now the building sits empty, but not for long. In February of 2021, we plan to open the doors to the Link, and what many of you have come to know as the Community Triage Center. The Link will serve those in our communities who are experiencing behavioral health and addiction challenges and need to get triaged or linked to the right places to help with those challenges. This is really messy work. This is really hard work. It's hard to bring together Sanford, Avera, the county, the city, all to work together towards one shared goal. It's hard to lift up the fact that you have a community that has challenges and needs a facility like this. I think ideally we'd live in a utopia and we wouldn't have to have a Link, but we do, and it's part of our responsibility as leaders to recognize that and to invest in our city, in our community. And so this work started long before I came into office. I don't even know what to say in terms of length, but probably 6 years-ish we've been talking about the need for a community triage center like the Link. And it's been a lot of work the last 2 years, and we're here. And so today is exciting. Today is very exciting. But it's not about necessarily any of us as partners today. It's really about a call I made early on in the process to my good friend Mitch Krebs, who was with the Helmsley Charitable Trust, and I explained this work, and I know that the trust, and I know that Walter, they have a passion for access, rural access, providing help to people and care to people who otherwise would not have a really easy way to access that care. And that's exactly what this facility is going to do. And so when I talked about it with Mitch, he said, you know, let me share it with our team, and let me share it with Walter, and share it with the trust, and see if there's an appetite to help support this project. And I met with the trust team, and several of the community health members in our community met with the trust team, and what was most impressive is that they have invested in projects like this before, the Helmsley Charitable Trust has, and they bring experience and knowledge to this. So there are times when you have partners that are financial supporters, but then there's times you have partners that not only are financial supporters, but also have a heart for the work and a knowledge for the work. And that's what makes this really unique today. And so with that, I'm very proud to turn the floor over to Walter Panzer with the Helmsley Charitable Trust. If you don't know a lot about Walter, he's an amazing guy who also has a background in public safety in our state, in our community. And the trust is doing a lot of amazing things, both in South Dakota and outside of South Dakota. And so on behalf of the city, I'm very thankful to have you here with us today, Walter. And I want to turn the floor over to you to talk about the announcement this morning.
Great. Well, thank you so much, Mayor. This is truly a great day for Sioux Falls and a good day for the entire community of Lincoln and Minnehaha County. Thank you for having me here virtually. I really appreciate it, as our schedules didn't quite match up, but we can do it this way. The Helmsley Charitable Trust is pleased to announce a new grant, a grant for $500,000 to the Link Triage Center. We are so pleased to partner with the City of Sioux Falls the counties of Lincoln and Minnehaha County, Sanford, and Avera, to address the problem of substance abuse and mental health on our most vulnerable populations in Sioux Falls. It's not too often it's not too often I've seen the whole community come together. Very few projects you can get competing healthcare systems, 2 different counties and the city all coming together for one interest. And that interest is to help these folks that are having a very challenging time with drug and alcohol abuse and mental health crises, and help get them help and help the community. Whenever I see a project with all the actors and all the players coming together, I know it's going to be a success. I was just thinking back over the last 10 years that the Helmsley Charitable Trust has been operating and working in the South Dakota and the region. I can only think of a few projects offhand where we have had every community stakeholder come together. And that project was back early on Mission Lifeline South Dakota, where we had competing healthcare organizations, they'd all come together. And this project removed a lot of it as well. Granted, totally different outcomes on it, but just the community rallying around to help these people and help the community and keep the community safe. So having a 24/7 mid-level care unit like the Link will help alleviate overcrowding in the emergency room. So that's a win-win for the community and Sanford and Avera, because these folks can get help here. They don't have to be in the emergency room at the highest level of care when they don't need it. It will help law enforcement. It will hugely help law enforcement because jail's not an option when someone is highly intoxicated. It's not a safe place for them to be. And the goal is, let's break that cycle. Let's break the cycle of substance abuse. And by getting them in a place like the Link, they'll learn, the people will learn about treatment options, and the Link will help them get set up to break the cycle of addiction. And the same way works with mental health as well. They'll help them get the mental health care they need, whether it's community-based or possibly, if it's severe enough, an inpatient approach. But it will help the entire community, help the law enforcement, help the hospitals. I'm just so excited to be a part of this project, and I'm real thrilled that the mayor was so proactive and such a huge supporter of this project, because it takes the leadership of the community, from the county commissioners to the mayor, to make this successful, to make this a priority. Like the mayor alluded to, it's difficult to admit that we have a problem in Sioux Falls and in our communities. But it's so important to have leadership come together, work with all the community members to come up with a solution to the problem. And I really think this is going to be a great solution. And I'm just really excited to see this launch in February and see the continued success that Sioux Falls and the surrounding communities will have because of this. Thank you so much. I'll turn it back over to you guys.
Excellent. Thank you, Walter. Two quick things I want to just reiterate that Walter said that are very important. And we talk a lot in this community about this concept of One Sioux Falls and what that means. This is what that means. How do we work together for a singular initiative? And if Sanford and Avera can work together, I mean, the Republicans and Democrats in D.C. could work together, right, guys? I mean, we've set a pretty high bar here. But in all seriousness, it's been so cool to work with these guys in such a unified fashion towards a singular goal. The second thing I just want to touch on that Walter also said it's very important. There's a call right now in our country for social reform programs. People want to see us not just use incarceration for every challenge in our community, but what are other options? And this is an answer to that. This is something we've been working on long before, the events of the last 3 or 4 months. This is the type of thing that Sioux Falls has been working on, and why I'm very proud that it's coming to fruition. So a big player in that has been Dean Karski. Dean is a commissioner with Minnehaha County. Dean maybe even started conversations on this back in his days with the city council. It goes back that long. So I'd like to turn it over to Dean to give a few remarks. So, Dean?
Thank you, Mayor. Quick unscripted comment. Mr. Panzer, I have to say, wow, you nailed it. You truly have a grasp for what we're doing and what we have going on here. I am impressed. Thank you very much for your involvement and your support. On behalf of the Minnehaha County Commission and the staff and taxpayers of our county that we represent, I want to thank the Helmsley Charitable Trust for their partnership and generous support of LINK. We are here today because of years of planning, and I know it's at least 8 from what the very beginning talks, and the work by many, many people. The Trust and their staff are generous partners in a project that will connect individuals with community-based resources during times of personal crisis, mental illness, substance abuse, etc. Close partnerships between the organizations represented at this press conference and organizations like the Helmsley Charitable Trust take time to develop and take the right people coming together to make it happen too. Thank you, Mayor. Early on in conversation, someone has an idea. What could we accomplish if? From there, plans get further developed as we roll up our sleeves and work towards something bigger. Today is a step towards something bigger. The local partnerships and collaboration with Helmsley Charitable Trust make this remodeling of this facility a reality. And without a facility, the project would go nowhere. So this is just a great step. I'll close my comments today by thanking Mr. Panzer. Thank you very much, and the Helmsley Charitable Trust for their generosity and helping us celebrate this day. Dave Fleechek, the president and CEO of Avera Hospital and University Health Center, also has comments that he'd like to share. Dave?
All right. Hey, thanks, Dean. And it is an exciting day. Avera is very proud of our partnership with the City of Sioux Falls, Sanford Health, Minnehaha, and Lincoln County, and also the gracious gift of Walter Panzer and the Helmsley Trust. It's a very significant partnership for us, and I think we said early on we needed to grab more partners and ask more partners to contribute so they have an ownership in this, because it really is a community issue. Mr. Panzer's passion for behavioral health is just amazing. To have a passion in behavioral health, there's a lot of other really cool things to have a passion about, but for behavioral health, we are very fortunate. In the last couple of months, I've had a couple mothers, fathers bring their son or daughter into our ER. And it really is not the right spot. It's a safe place at times, but it's not the right spot. The link is where they really can come and get access to services to bridge them into the community. And that's what I feel good about, is that we're going to make a difference in this community. So I want to again thank the mayor, Paul, and Dean, and Mr. Panzer. Thank you for everything that you have done, and I can't wait to move this forward. Thank you, everyone. I'd like to now introduce, believe it or not, Paul Hansen, my colleague at Sanford Health. And honestly, we get along great, and this is a community project that we are both unified on. And sometimes it takes community members to put everything down and do what's best for the community. So Paul, I want to thank you and welcome you to the mic.
Great, thanks. Well, first of all, thank you all for being here today to help us celebrate. Walter, thank you so much, for what the Helmsley Charitable Trust has done for this community, today, and what you've done in the past and what you'll do in the future. We owe you so much, and we're so confident that you feel confident enough in us to provide that investment. So thank you so much. Sometimes it's what you bring together that sets you apart. And I think that ties back into the message that you've already heard today from all the leaders here. And for me, it's very personal. For me, it's very personal because I lost my mother to alcohol addiction. And I tried everything I possibly could. We had the resources to provide her some great care, but it just wasn't enough to beat the demon. And so for me, this is very personal. It's an opportunity for us to make investments within our community to help those who you know, in some small way, in my mind, it's helping my mom again. I don't know if you can understand that or you can appreciate that, but for me, that's what it's all about. You know, as I look at the community needs assessment that we've had done within this community, and we've had it done for a number of years, behavioral health is always the number 1 or 2 issues on top of that community needs assessment. We've got to do something about that. This is doing something about that. And there's so much more. But I think the ability for us to get together, to be on one page, to be one team, to be one Sioux Falls team, with the help of our partners at the counties, with the help of, you know, the Helmsley Charitable Trust, we can make a difference. And I want to say thank you for all that you do. Thank you for being here. And more importantly, thank you for getting the message out to those in need. Thank you. Mayor?
All right, so we'll wrap up here and move into some questions if you haven't. But before we do that, there's a couple people that really just need to be recognized. And I will say that where this project really started to get some momentum is when we hired a project director. And that really helped because I always use a phrase with my team, if everybody owns it, nobody owns it. And we needed an owner of this thing to help move it forward. And that guy is Steve Lindquist. And Steve has been an incredible champion for us. And Steve, thanks for your work. On the county side, we have Carrie Benz, has been a champion for us with Minnehaha County. Alicia Kalura, Jill Franken with the City of Sioux Falls, the team there. Aaron Surska with the USD, and Clara. You guys obviously have been incredible champions of this work as well. And so I'd love if you would just give those folks a round of applause. They're very important people. And there's a lot of other folks too, from Lori Popkeys and people, Andy Muncie at Sanford, and just so many folks that have helped make this thing a reality to where we are today. So we're anxious to start sticking some hammers into some walls here and transform it per the design that you see from Miller Sellers Hero, who's the architect on this project. And so with that, we would certainly love to entertain any questions. We're honored to have Walter here as well, and he's available for questions as well. And so, Steve, maybe I'll invite you up and you can moderate the Q&A. Is that all right? So people can see that you're a real person and get you behind the podium too. So with that, we'll certainly take any questions, and Steve might be able to answer them for any of the partners or for Walter.
Questions?
Yes, I have a question. Beth Gordon from Dakota News Now. Could you explain, are the referrals for individuals coming here only from medical professionals and law enforcement? Or could someone make an appointment or walk in to be seen as well?
The question is about referrals and referral sources. This will be a facility that's available for anyone. There'll be some referrals that will come through healthcare. There'll be some that will come through law enforcement, but we hope that a lot will come just from people themselves wanting to seek help. A couple weeks ago, I was on a conference call with a couple of folks, one of which was from addiction recovery program here in town. And she's in recovery, and she said that as she heard this about this program, she said, had this been available for me 10 years ago, when I was in crisis and I had a place to go where I could go talk to someone and get the start of some help, she said, I think I would have gained 10 years of sobriety. So I think that's the kind of impact that we can expect from this facility, and we want people to openly use it as they feel that they're having some challenges in the behavioral health arena.
I have another question. Could you walk through the process either with a medical professional or law enforcement, what kind of criteria or the kind of a flow chart that they go through to be able to present this as an option to someone who they've just incarcerated or somebody that just came into the medical facility?
Sure. Question relates to referrals and sources in the process. We think this program will have a very big impact on the local emergency departments, because right now where do you go in a crisis? As we heard, you go to the emergency department because that's a place where you can get help 24/7. This will be a place you can get help 24/7. There'll be medical resources available here for that kind of, not an ED assessment, but steps down from that medically to make sure that someone is okay medically and then start the intervention process. So we will get referrals from the emergency departments. We will also, we've been talking with the ambulance service and believe that there'll be an arrangement so ambulance can use this facility when it's appropriate as opposed to always having to go to the emergency department. So there'll be some benefits there for everyone. For law enforcement, it will continue to have the sobering center component that exists now under Minnehaha County. It will just be located here. And law enforcement utilizes that program. But it can also be used for folks who are walking in. So we're not making real strict criteria, frankly, for someone to use this service. We want to have very much of an open door arrangement so people, if they feel they're in a behavioral health crisis, can come here. There are other resources in town, and we're not saying don't use those as appropriate. But this will be another resource people can have that will be available 24/7 to help them through that crisis and get linked up with other resources if that's the need.
And is the $500,000, does that help meet the fundraising goal, or are there still funds that need to be collected for that?
Mayor, do you want to address that?
So the question was, is this gift from the Helmsley Charitable Trust, does that get us to the point where we can operate this facility and feel comfortable financially? We still have a little bit of work to do to make up our funding model. We're working off a 3-year pro forma, and so specifically what the gift from the Helmsley Charitable Trust will do is we'll go towards the build out and the construction work of getting this facility ready. Then the annual operating for each of the 3 years will be the responsibility of these 4 partners right now. Right now, based on that pro forma, we still have a little pencil sharpening to do. And so we're working to figure that out. But we're not going to let that delay the project. So I'm confident enough with the brains trust of the board that we'll figure out a way to close that gap, but we're very close. All right. I don't see any other questions. While Walter's still on, are there any final questions for Walter that anyone might have? All right. Well, Walter, thank you, sir. Again, from the City of Sioux Falls, from these partners, and on behalf of the Link Board, this made my month. This made my year for this project because we appreciate it. All right, well, with that, Steve or any of the other partners here would also be available for one-on-ones if anybody wants to speak to them. So have a great day, everyone. Thank you.